Assalamu alaikum students. Today we are going to start gross anatomy of eye, and first of all we will discuss the bony orbit. The orbits are pyramidal shaped bony cavities present one on each side of the nasal cavity. As it is pyramidal in shape, it has an apex which is present just medial to superior orbital fissure, and a base is formed by the orbital margins which open on the norma frontalis. Each bony orbit has a roof, floor, lateral wall and medial wall. Now we will discuss the boundaries one by one. First of all, roof. Roof is formed mainly by the orbital plate of frontal bone, and it is completed posteriorly by lesser wing of sphenoid. Roof separates the eye from the anterior cranial fossa. The lacrimal fossa is placed anterolaterally in the depression and it lodges lacrimal gland. The optic canal is present posteriorly, just medial to apex of the orbit for the optic nerve, and near this one medial margin of the eye there is small depression called trochlear fossa which lodges pulley or fibrous pulley or trochlea for the tendon of superior oblique muscle. Now you can see the roof in the model, and the roof is formed by this one. This is orbital plate of frontal bone and posteriorly by the lesser wing of sphenoid. This is optic canal, and on the lateral aspect this one is lacrimal fossa which lodges the lacrimal gland, and medially a small depression which forms trochlear fossa. Now you can see the wire which is present in the optic canal, and this depression is lacrimal fossa and small depression just near to margin is trochlear fossa. Now lateral wall, it is thickest and strongest of all the walls of orbit. It is formed posteriorly by the anterior surface of greater wing of sphenoid bone posteriorly and the orbital surface of the frontal process of zygomatic bone anteriorly. The greater wing of the sphenoid separates it from the middle cranial fossa, while the zygomatic bone separates it from the temporal fossa. We can see superior orbital fissure in this surface at the junction of roof with the lateral wall. This is superior orbital fissure, and there are two minute canals which contain openings for zygomaticofacial and zygomaticotemporal nerves on the zygomatic bone, but we can't see it on the atlas. So lateral wall, it is formed mainly by the anterior surface of the greater wing of sphenoid. This is orbital surface of the frontal process of zygomatic bone and posteriorly superior orbital fissure. So this one is orbital surface of frontal process of zygomatic bone. This is anterior surface of the greater wing of sphenoid, and this one is superior orbital fissure. And there is small palpable elevation that is called zygomatic tubercle. It is present just near the margin and it provides attachment for the lateral check ligament of the eye. It is called zygomatic tubercle. Next is floor of the orbit. Floor is sloping upward with the medial wall of the orbit. It is formed mainly by the orbital surface of the maxilla bone. Posteriorly, this small area is by the orbital process of palatine bone. I have shown you the orbital process of palatine bone, and anterolaterally by the orbital surface of zygomatic bone. At the junction of lateral wall and floor, there is an opening. This opening is called inferior orbital fissure. This inferior orbital fissure communicates with infratemporal fossa and pterygopalatine fossa we have discussed already. In the floor, there is a groove. This groove is infraorbital groove, which leads to canal, which is called infraorbital canal within this floor, and this canal open on the norma frontalis at infraorbital foramen. Now floor, which is formed mainly by the orbital surface of the maxilla and orbital surface of the zygomatic bone. This one is infraorbital groove and this is inferior orbital fissure. Floor in the original skull. This part is orbital surface of the maxilla. This one is infraorbital groove. This is inferior orbital fissure. And the wire is in infraorbital bony canal which leads to infraorbital groove in the floor of orbit. Now medial wall of the bony orbit, it is relatively thin as compared to other walls. It is formed anteroposteriorly by frontal process of maxilla. This is lacrimal bone. This is orbital process of ethmoid bone and most posteriorly body of sphenoid. Now at the junction of roof and medial wall at frontoethmoidal suture, we can see two foramina, anterior and posterior ethmoidal foramina. This ridge is called lacrimal crest of the frontal process of maxilla. This ridge is crest of the lacrimal bone and this area between the two is called lacrimal groove. This lacrimal groove lodges the lacrimal sac which leads inferiorly to nasolacrimal duct which opens in the lateral wall of nose. Same medial wall on the original skull. This is lacrimal crest of the frontal process of maxilla. This one is lacrimal bone and this is crest of the lacrimal bone, and between the two this is lacrimal groove which leads to nasolacrimal duct which opens in the lateral wall of the nose. So this is lacrimal bone. Then behind this is called orbital process of ethmoid and these are anterior and posterior ethmoidal foramina. And at the end we will revise with the foramina. So you can see the wire in the optic canal, superior orbital fissure, inferior orbital fissure, infraorbital groove, and this one is lacrimal sac.